The birth canal of mum or contact with other infected people can cause an eye infection in a newborn that may lead to the #1 cause of blindness on the planet. I'm going to brief you, in short video, how to make sure it doesn't happen to your baby. You need to be aware of this. I'm Dr. Chris, MD, helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So trachoma is a bacterial infection that affects the eye of newborns and anybody beyond that point. It's caused by Chlamydia trachomatis. It's a germ. Now in Greek, trache means roughness, as that is what is caused exactly under the eyelids by this germ. This is the same germ that also causes a sexually transmitted disease called Chlamydia infection. Now realize that when a baby gets born, the head gets and the eyes are squashed through the vaginal canal or the birth canal that may contain sexually transmitted germs. So trachoma is contagious. It's spreading further through contact with eyes, eyelids, and nose or throat secretions of infected people to your baby. Hands, clothing, towels, and insects can also be routes for the transmission to the baby. Chlamydia trachomatis infects the lining of the cervix, the mouth of the uterus, the urethra, which is the urinary channel, the rectum, as well as non-genital sites such as the lungs and the eyes. Did you believe it only happens to starving people in Africa, this chlamydia? Think again. This bacterium is the cause of the most frequently reported sexually transmitted disease in the United States, which is responsible for more than 1 million such infections annually. Now, in neonates and infants, the bacterium can cause conjunctivitis and pneumonia in the lungs. So at first, when it gets into the newborn's eyes, trachoma may cause mild irritation and itching of the eyes and the eyelids, and then you may notice swollen eyelids and pus draining from the eyes. Untreated trachoma can lead to blindness. In fact, trachoma is the leading preventable cause of blindness worldwide. Now, trachoma can occur worldwide, but it's more common in poor areas like in Africa, where 85% of people with active disease live here. Now, in areas where trachoma is prevalent, infection rates among children under the age of 5 can be 60% or more. Now, many infants infected with Chlamydia trachomatis at birth remain infected for months or years in the absence of specific antimicrobial or antibiotic therapies. Early diagnosis and treatment may help prevent trachoma and the complications. Please subscribe and click like if you're getting value from this video. Then with the algorithm, YouTube will show it to more people that can benefit. Thank you. Most grown-ups with this infection are asymptomatic. Untreated infection can result in serious complications such as pelvic inflammation disease, infertility, and ectopic pregnancy, where the pregnancy is outside the womb because the tubes are blocked in women, and epididymitis and orchitis in men, where the testicles become sore and inflamed. Now, men and women can even experience chlamydia-induced reactive arthritis or joints starting to hurt. Most persons who are infected with Chlamydia trachomatis are asymptomatic. However, when these symptoms of infection are present in women, they most commonly include abnormal vaginal discharge, vaginal bleeding, including bleeding after intercourse, and even dysuria or painful burning urine. So advanced cases can get chronic reactive arthritis or lymphogranuloma venereum. It's a one-sided or unilateral tender inguinal or groin or femoral lymph node, and it may include a genital ulcer or even a lump on the genitals. So trachoma conjunctivitis is a chronic or recurrent eye infection that leads to scarring of the eyelids, often inverts or flips the eyelid, starts bending the wrong way, and causing abnormal positioning of the eyelashes that can scratch and damage the bulbar conjunctiva or the white part of the eye. Trachoma is the primary source of infectious blindness in the world. Wow. Symptoms. Signs and symptoms of trachoma usually affect both eyes and may include mild itching and irritation of the eyes and eyelids. It can be eye discharge containing mucus or pus. It can be eyelid swelling or light sensitivity, photophobia. It looks like people don't tolerate sharp light or bright light. There can be eye redness, there can be eye pain and vision loss. Now, young children are particularly susceptible to this infection, but the disease progresses slowly and the more painful symptoms may not emerge until adulthood. So without intervention, a disease process that begins in childhood can continue to advance all the way into adulthood. Now there's 5 stages of trachoma and the complications of it. First, there's one episode of trachoma caused by Chlamydia trachomatis, and it's easily treated with early lab swab tests and detection and the use of antibiotics. Then we can have repeated or secondary infections that can lead to these complications. So inflammation, a small amount of rough bumps on the inner surface of the upper eyelid and the conjunctiva. Intense inflammation is the next step. Then the eye is now highly infectious and becomes irritated with pus and thickening or swelling of the upper eyelid. And then the next step is eyelid scarring. The chronic infection leads to scarring of the inner eyelid, especially the upper one, and the scars often appear as white lines when examined with a magnification or a microscope. The eyelid may become distorted and it may turn in, so we call it entropion. And in the worst cases, then the inturned eyelashes are scarring the inner lining of the eyelid, continues to deform, causes the lashes to turn so that they rub on and scratch on the transparent outer surface of the eye, the cornea. And then corneal clouding can happen, or opacity. It gets dull. The cornea becomes affected by an inflammation that is most commonly seen under the upper eyelid. Continuous inflammation compounded by scratching from the interned eyelashes leads to clouding of the cornea, and then they start going blind. So what is the treatment? Antenatal screening at first visit and treatment with antibiotics if detected in the mother. Pus swabs done on neonatal conjunctiva and sent to the lab for culturing and diagnosis if there's any suspicion. Use facial cleanliness of infected people to limit the spread. Advanced eye problems require surgery, of course. So safe sex practices can help, avoiding high-risk behavior such as having unprotected sex or multiple sex partners. In addition to the correct and consistent use of the condoms has also been shown to reduce the risk of transmission of sexually transmitted disease, and then the baby eventually getting it when it's born. So environmental improvements in general, particularly in water, sanitation and fly control, can help combat this disease. Now you know enough about trachoma to recognize that you need to get pussy eyes of a baby tested by your doctor and not just make it out of something negligible, okay? How are you enjoying your baby? Do you have any challenges? Comment below and I'll make more videos. Just tell me what you'd like to see and know more about. This is Dr. Chris signing off. Ciao mamas, thanks for watching.